Bismillahirrahmanirrahim. So, welcome to all on how to pass FCPS-2 gynae in first attempt. Now, we will discuss about the different stations, the important topics regarding the short cases, the drills, and different research topics which can be claimed in your exam. The different short cases in the OPS include the major topics here like hypertension in pregnancy, anemia, diabetes, bad obstetrical history, very, very important. Twins or triplets, anomalous baby, PFROM, breech baby, VBAC, cardiac patient, thyroid, APLS, antiphospholipid syndrome, SLE or epilepsy, and obstetric cholestasis and puerperal sepsis. So these are the major topics that can come in your short cases in your history and examination stations. And then in the link station, you will be asked about the investigations and the management. These are the major topics that can become in your exam. The gynae major topics for the short cases include heavy menstrual bleeding, mass abdomen, which can be anything, ovarian cyst, fibroid malignancy, subfertility, any malignancy, UV prolapse, incontinence, PCOS, primary amenorrhea, endometriosis, and fistulas. So these are the major gynae short cases, the link stations. The obstetrical drills, and now in the exam, we are obstetrical drills and the gynae drills. They can become either the station in like drills or teaching station. So regarding the labor, the important drills you need to cover in the OPS for your FCPS TOACS exam. Part 2 is the clinical pelvimetry. Others are obstetrical examination, all the labor maneuver, mechanism of normal labor, delivery of head in occipito-posterior position, assisted vaginal delivery, I think forceps or vacuum, or kiwi cup even. Breech delivery, external cephalic version, internal podalic version, twin delivery, manual removal of placenta, or episiotomy. The obstetrical drills, the emergency drills includes shoulder dystocia, postpartum hemorrhage. The station can be covered in either a cervical or vaginal tear repair or episiotomy repair, uterine compression sutures, B-Lynch, Nasika, and Arshad Chauhan suture. You should know each and every suture type. Uterine and internal artery ligation, balloon tamponade, and its different types. Steps of hysterectomy, cord prolapse, which is an emergency drill, uterine inversion, BLS in collapse patient, which you have already covered in your CPSP workshops. Needle resuscitation, very important. And now comes the gynae drill. The gynae drills include intrauterine contraceptive devices, copper T, Mirena, and their types as well. Manual vacuum aspiration, implanon and other types like Jadale, Lexplanon, pap smear and colposcopy, pipal sampling, DNC, hysteroscopy, hysterosalpingiography, IUI, ring in pastry, McQueen, perineal tear repair, hysterosalpingiography already discussed, TVT repair, transvaginal tape, how to perform that, bladder repair, and ureter repair. How to perform the drill? I will include the start, introduction, and the end points, which you can, if perform or memorize, you can easily get marks. So, how to start and how to perform a drill? Start with, I will introduce myself to the patient, take informed consent, explain whole procedure. After fulfilling all the prerequisites and ruling out contraindications, I will proceed to perform that drill in front of a chaperone. I will ask my patient to empty her bladder and lie supine comfortably. Do the examination if necessary, help in proper exposing with the privacy, and then demonstrate the steps of the procedure. So this is very important. If you start with these, it contains 0.5 or 0.25 marks of each and every word I have told you. The end can be, in the end, I will help in dressing my patient, say thanks to the patient. More importantly, very, very important, never ever forget to document the things. Document with the date, time, name, and signature, and then follow. Do the follow-up or ask the patient for the follow-up. This is how you will perform the drilling exam. So, importantly, another station that comes in your exam can be either the labor board prioritization or gynae board prioritization. How to prioritize the labor board? These are the small tips and tricks I will share with you, and in detail I will share in another video. Remember, priority can be changed anytime according to the scenario. Any life-threatening situation for the mother, it should be the topmost priority in the labor board, and it should be covered or dealt by the senior registrar, co-chair, or the senior most resident present. It includes bleeding, antepartum hemorrhage, postpartum hemorrhage, or any drug reaction, anaphylaxis. Then the second priority after a life-threatening bleeding or drug reaction includes eclampsia, and it can be dealt by the second most senior resident, either the fourth year or the third year available. Then comes the fetal distress. It can be the second most or the third most priority depending upon the different stations and the patients. It can be dealt by the third year and second year. Remember, besides having acute fetal distress or acute bradycardia, always first go for the conservative unit. Do not expedite the delivery unless required in fetal distress. Then comes the comorbid patient like high-risk patients including the OPS coli, pregnancy-induced hypertension, GDM, twins, VBAC, breech, grand multi. The risk of PPH is there in the grand multi, so it can be dealt by the second year, and the semi-routine urgent cases. The type of the miscarriage comes afterwards according to the type. If it is the incomplete miscarriage and the RPOC is in the cervix, so the patient can undergo the vasovagal shock. So please prioritize that it should be your topmost priority according to the type of miscarriage. However, in the case of miscarriage and the patient is not bleeding, it can be a day-case procedure or the ward admission procedure, which can be dealt by the house officer and be prepared for the list for DNC on the next day. Then comes episiotomy to be staged. It can be done by either the house officer or the midwife. And if any has ward admission or any problem related to the ward, which is stable, like if the GDM patient with increased BSI, it can be dealt by the physician or the house officer. So this is how the main steps to prioritize your labor board. More will be discussed in detail in the next video. The next station is the WHO Labor Care Guide. You should know how to fulfill all the steps in this labor care guide, which include the 7 components. And after at your step in the FCPS Part 2 TOACS exam, the labor care guide doesn't come in an easy way. You have to complete all the points in the labor care guide, and then you will be asked about now how to manage at this step. So you should first complete the steps, fill the plot given, and then tell about the further management related to that particular station or scenario. Laparoscopy comes in your curriculum, so you should know each and every detail about the laparoscopy, which includes the types, diagnostic and therapeutic, and then you should know how to identify the structure and its different parts, indications, contraindications, and complications of the laparoscopic procedure, the medium used, type of anesthesia, position during the laparoscopic procedures, and RCD classification of the laparoscopic procedures, which are level 1, 2, and 3. So you should know each and everything related to the laparoscopy. While in the research, the scenario can be in the exam regarding any research scenario. You will be asked about the scenario and then asked how you will perform the research. It can be either the cross-sectional study, cohort, or the case control study. It can be either the audit cycle, the description of the forest plot or funnel plot, protocol writing, clinical governance article, and the leaflet appraisal. So these are the points which can become in your exam. What you need to pass exam in the first attempt FCPS talks then. A valid study material. Please do not fall for the different books and any other material which is not evidence based. A good orientation of the exam and its station. Practice makes a man perfect. So you know each and every study material as you have already passed the written exam. Just practice all the different type of stations, how to perform the typical and particular station. You should be confident, have faith, and believe in yourself. So if I can do it in the first attempt, why can't you? Believe in yourself. Thank you and good luck.